And we are happy today to announce that we are going to offer a plan that would give all senior citizens in the country the same congressional health care plan that we have. We are not willing to wait till after the next election to fix the entitlements. The entitlements are broken. It's not Republicans' fault. It's not Democrats' fault. I tell people it's your grandparents' fault for having too many kids and then your fault for not having enough kids. It's a demographic problem. We used to have a bunch of workers, 50 workers to one retiree. Now it's 3 workers to one retiree, and our pension plans as well as our Medicare plan are insolvent because of these facts. This plan would give every senior citizen the congressional health care plan that we enjoy, and in doing so would save over $1 trillion over 10 years. It means tests the benefits and gradually allows the age of eligibility to go up. Millionaires would have to pay for their Medicare, pay the full price. On average right now, the average U.S. citizen pays in $100,000 over their lifetime in Medicare taxes, but they receive over $330,000 worth of benefits. That's why the system's not working. This would be a system that brings in some market incentives to this, would save money for all. I'd like to thank Senator Lee and Graham and DeMint for co-sponsoring this. I'd also like to thank John Kerry for letting us borrow the idea. This was his part of his campaign platform in 2004 to put folks into the congressional health care plan. We have sent him the specifics of this plan. We have sent and talked to and sat down with many Democrats on this plan. We would love for you to ask Senator Kerry if he's going to support his own plan. Senator Lee.
I'd like to thank my colleagues, particularly Senator Paul, for taking the lead on this, showing the leadership to conquer a problem that is of concern to all Americans. At the end of the day, this is an idea that is neither Democratic nor Republican. It's neither liberal nor conservative. It's simply American, and it's moving a system that is troubled and that faces really difficult times ahead, and puts it on a path toward some sort of sustainability that is badly needed in the system right now. Saving $1 trillion over the next decade and even more thereafter. So I'm proud to be a part of this effort, and look forward to seeing this move forward as it gains momentum on both sides of the aisle. I'll turn the time now over to Senator Graham.
The elephant in the room for the country is entitlement reform. These two gentlemen have been here for about, I don't know, a little over a year. They've engaged in trying to save Social Security from bankruptcy. I've worked with them on that issue. Now that Rand has come up with, I think, a very creative plan to make sure that Medicare that health care for seniors is sustainable. And Medicare, as it's constructed today, has got so many demographic problems, so many structural problems. Part D, the prescription drug program, had a provision in it saying that anytime 45% of the general treasury funds were used to support Medicare, a trigger was to be pulled to redesign the system. 3 years in a row, the trustees have told President Obama the Medicare program has over 45% of its funding from the general treasury, and nothing's happened. So this is a great, innovative idea to give Americans today and tomorrow the same health care members of Congress have. Trust me, it's a good deal. We designed it. I can assure you, you will like it. The question is, will we provide it to you? So the big elephant, as I said in the room, is Medicare, Medicaid, and Social Security. And if we don't get this right, we're going to lose our ability as a nation to sustain the American dream. And when it comes to entitlements, the one thing I can tell you for sure is that Ronald Reagan and Tip O'Neill showed us the pathway forward. Democrats and Republicans working together to solve the problem. The 4 of us are offering to our Democratic colleagues and Republicans an effort to bridge the partisan gap on Medicare using an idea that was generated from John Kerry. Rand, thanks a bunch for putting this together, and I look forward to seeing if we can solve Medicare this year before the election.
Well, the President and Harry Reid have been licking their chops for over 3 years now, waiting for Republicans to actually try to deal with the large problems like Medicare. So this is the moment they've been waiting for. But I think if Americans actually find out the truth about what we're doing, it will be a very big positive for Republicans in the fall. Think about where we are with Medicare. Many, many seniors cannot find a doctor because we don't pay our doctors enough to see Medicare patients. Many times the payment is less than the cost. And this is a phenomenon that is increasing. Every year we fight about what we call the doc fix, and we're not increasing what we pay doctors as fast as medical inflation. So we cannot maintain the status quo, and if the Democrats pretend that we can just keep the Medicare system that we've got, they're not telling the truth, because not only will it go bankrupt, but seniors won't be able to find doctors as tens of thousands of baby boomers hit retirement. What we do here is what employers do. Probably every reporter here is on some type of plan that's similar to our congressional plan, where your employer pays most of the cost of your health insurance and you pay a part of it. I did that in my own business. That's what we do in the congressional plan. And that's what Senator Paul's proposal, who, by the way, is a doctor and understands a little bit about what happens in the healthcare field. This is a real solution that not only will cut the cost of Medicare and reduce the deficits over the years to come, but will give seniors a health care plan that will open up every doctor to see them. So this is good for the American health care system. It's good for seniors. I'm sure our Democrat friends will distort what they, in fact, have suggested, including Barack Obama, that we need to give seniors what we give congressmen. It's here. Let's see how many Democrats actually sign up. Thank you, Senator Paul.
Thank you. We're happy to take any questions.
Could you tell us how large the premium support that you're initially setting is for seniors, and what your inflator is each year?
It'll be the same that we have now. Our health care plan, the Congressional Health Care Plan or the Federal Employee Health Care Plan, is 75% subsidized. The one thing we do differently, though, is we take it and we apply an income means test to it. If you have over $1 million a year in income, you'll get no subsidy. If you make between $200,000 and $1 million, you'll only get a 15% subsidy. If you make between $100,000 and $200,000, you get a 30% subsidy. And we can hand you out the chart on this. But basically, the more you pay, the less yours is subsidized. So there is means testing to this. And the reason you have to do that is we're spending more on Medicare than's coming in. So you have to have some ability to bring down costs for those, or allow people who made more money during their career to absorb more of the real cost of Medicare.
So how would it work when a senior actually at the beginning of the year received a check in the mail for 75% of premiums for the FEHB?
No, it worked just like our plan does now. You'd enroll in the Federal Health Employee Plan, and it is subsidized, but there wouldn't be any exchange of checks to an individual.
Some sort of mandate to ensure no adverse selection?
This would be everybody gets it. Everybody who is Medicare eligible, this will be the new Medicare.
But for seniors who don't take the insurance and don't want to pay out of pocket for whatever costs they're liable for, if they just sit out of the system?
Well, there is an option out of the system is voluntary in that sense, but it will be the new Medicare. This will be Medicare. Medicare will be the Federal Employee Health Care Plan. Can you opt out of it? If you still are working and your employer has insurance and you want to keep your employer's insurance, you could do that.
The 75% is at 75% of any plan, even the most expensive plans, or is it capped at a certain level?
There are like 250 different choices currently in the Federal Health Care Plan. We actually open that up some. What we do is we wanted to make sure that all insurance companies could get in, so we made the rules more liberal for more competition. So we want more insurance companies to come into the Federal Employee Health Care Plan. They're somewhat restricted now. We're going to make it more expansive to allow more companies to come in, but it'll work exactly the same rules as the Congressional Health Care Plan is now.
And then how do you cap for inflation, or how is it keeping Medicare costs down?
Peter, do you have an explanation?
Same as OPM does today.
Same as we do now.
75% is the average subsidy.
Anybody else?
Two questions. One is, what's the phase-in on this? And secondly, how do you respond, as Senator DeMint said, about Democrats who are going to say you're ending Medicare as we know it?
I heard the first part. I didn't hear the second part.
The first question is the phase-in. How is this?
Right. It starts in 2014. The age is phased in 3 months a year, goes up 3 months a year, and it'll go up to age 70 by the year 2040.
And are people allowed to still stay in Medicare?
Everybody will get the Congressional Health Care Plan. This will be Medicare.
And so what do you say to Democrats who say you're ending Medicare as we know it?
We're giving them something better. You know, the Congressional Health Care Plan is a good plan. Ask any person in America, would you like to have the Congressional Health Care Plan? I think you'll find that most people would say yes.
Can I?
Yes, go ahead.
And maybe we could ask a Democrat or Republican, how do you envision saving Medicare as it is today? How do you keep this system sustainable? Why haven't you pulled the trigger when it got to 45% of general treasury funds? When you look 20 years from now, if nothing changes, Medicare and Medicaid will consume the entire revenue stream just for those two programs. How can you save Medicare as it's designed today without means testing, without age adjustment, and without competition to create more quality and more choices? The answer is in front of us. All of us have enrolled in this program for us and our families because it is a good deal. It gives us more choices. And if you're going to replace Medicare with this plan, the minimum benefits today have to be guaranteed by the insurance companies that are going to participate. How can this work? It just shows you what happens when you get into a plan that has more choices, more competition. And it also shows you what happens when you means test and age adjust. And I would suggest that Medicare as we know it is a false promise. It is unsustainable. So anyone that tells you that Medicare will be here 20 years from now without breaking the bank, without putting us in eternal deficits, I don't think is being honest, because I don't see how you get there from here without reforming Medicare along the lines of what we're talking about. So rather than inventing something new that's complicated, why don't we take a program that's worked for years in a fashion that people can relate to? If it's good enough for your senator, it ought to be good enough for you.
Any other questions?
Senator, the rank and file who are in this program also like it, but they've said, and folks who track this closely have said, if you do something like this, you potentially are going to make it a less attractive program because you're going to be adding so many more people. And there's concerns that if you do something like this, Congress may not give the money necessary to actually run it. So how much more money would you offer, and how many more government employees then conceivably would you hire?
One of the things is I don't think that congressmen or senators should get something that other people don't get. And so it should be fair. We shouldn't get more or less. When you add it in, the cost per person is going to be a little bit higher. Right now we pay $11,000 per person for Medicare, the taxpayer does. Right now for the federal employee health plan it's $5,000. It's going to be about $7,000 when you put an older crowd in there. Federal employees, including myself, will have to pay. It's about $30 a month more. But I think that's something we have to do to make it fair and to help save Medicare.
Senator, what would you say to somebody who's close to Medicare eligibility age now, and they've worked under the current system, and they say to you, I want to be under traditional fee-for-service. The people I know who are on it like it, it works well, and I've worked all these years to be eligible for it. How do you deal with
Do you want to answer?
Well, unfortunately, politicians in Washington have starved Medicare to death. It is not going to be there in 5 or 10 years if we don't do anything. They're not going to be able to find a doctor. And as Senator Paul says, we have to convince them this is something better. If we, as senators, this is better for every American, and the more competition there is, the lower the prices will be. Seniors, and every senior will have some skin in the game because they'll pay part of the plan, just as we do. If we want to pick a more expensive plan here, we pay more for it. If we want to save money, we can pay less. So there's going to be that market dynamic here, but everyone can be covered. No one can be refused. Every senior citizen will be on a plan that they can afford and that doctors will take. And they're not going to do that for Medicare much longer.
That's a very good question. I would say to those who are getting ready, that are afraid of change, change is coming. Let's just control how it comes. Instead of have a crash landing, let's create a bridge to a new system. That as Jim just said, go out and try to find a Medicare doctor today. These boutique medical practices are breaking out all over the country because doctors are worried about Medicare, Medicaid reimbursement. So what I would tell the person near retirement, don't fear this change, embrace it, because they'll have more doctors available to treat you and your family. At the end of the day, it will be less out-of-pocket cost because this program is more efficient than traditional Medicare. And think about not just what happens to you. You're going to get as good a deal, if not better. Think about your country. Think about where we'll be as a nation if something doesn't change pretty quickly with these big programs. So I hope the combination of this, you're getting a better deal, you're getting more doctor options, and at the end of the day, it will save your country an enormous amount of money and still provide quality care. I think hopefully will sell.
And one additional point on that before we go to the next question. Medicare is estimated to be $35 to $40 trillion short right now. So there is a real problem facing us. If you give people and say, oh, we're going to keep traditional Medicare and give you the option of the Congressional Health Care Plan, the CBO scores that as zero savings. So you get no savings because they're not positive anybody changes out of it. Even though we think it's a better system, if you give people inertia of staying where they are versus moving, they may not move to where the savings is. And we think this is a better plan. It's less out-of-pocket cost, less premiums. There's no reason why. But the Wyden and Ryan proposals that give a choice, the CBO scores them as zero savings. So we're not going to get any savings if we keep both plans existing.
I wanted to ask you, as early as next week, Senator Reid may bring the Democrats' version of the Violence Against Women reauthorization to the floor. I wondered, could you describe what your opposition is to that, if in fact you oppose it? And are you concerned at all that Democrats are trying to use this as a tool in this, against Republicans as part of this, war on women?
I think we're going to save that because we're talking about whether we're going to support their alternative or our alternative or what the alternative should be. And I don't know if I've made necessarily a decision on that. We'll do one more question on Medicare.
Why is it good to offer seniors an exchange of sorts, subsidized by the taxpayer, but you guys are still resolutely opposed to the health care law, which basically does the same thing for everyone else?
Anybody want to comment on that?
Medicare is already set up as a government program. So we're beginning to privatize with this idea. To go the other way in the private sector for people who have private employment and to begin to bring that under government control and to define benefits is completely the opposite direction. So what we're trying to do with Medicare is move it back towards a plan that we would like, where people have the choices of private plans, a wide choice, without all the restrictions Obamacare puts on it. And so the exchange is very simple in this case, and I think it will become simpler and simpler. But one last point I'd like to make, if you want to understand the motivation of the Democrats, it's not going to be that this is not a good plan, because again, if it wasn't, we wouldn't be on it. But what they don't like about it is the government loses some control over Medicare. It's less of a political tool every year because everyone has their own plans, and it's basically on autopilot, where just like our plan, the premium support will rise with inflation, I think, is the way it's set up. But they don't want this because they know a dependent voter is a dependable vote. And this is the type of thing that is basically kryptonite to a Democrat, because it gives people choices, it gives them freedom, and it takes them out from under that manipulative umbrella of the Democratic Party. So that's what this debate's going to be about, but we're going to invite them to put their money where their mouth is. They have said for years that this is what we should do. Let's see if they really do it. Thank you.
Thanks.
Oh, did I?